Which of the following is the recommended initial empiric antibiotic regimen for septic shock? A. A single broad-spectrum antibiotic. B. Combination of a beta-lactam and a fluoroquinolone. C. Combination of a beta-lactam and an aminoglycoside. D. Combination of a beta-lactam, a macrolide, and a fluoroquinolone. Answer: C. Combination of a beta-lactam and an aminoglycoside. Which of the following is the most common source of infection in septic shock? A. Respiratory tract. B. Urinary tract. C. Intra-abdominal. D. Skin and soft tissue. Answer: A. Respiratory tract. Which of the following is a contraindication for the use of corticosteroids in septic shock? A. Refractory hypotension despite adequate fluid resuscitation and vasopressors. B. Relative adrenal insufficiency, inadequate cortisol response. C. Presence of gram-negative sepsis. D. Recent history of gastrointestinal bleeding. Answer: D. Recent history of gastrointestinal bleeding. Which of the following is the preferred site for obtaining blood cultures in septic shock? A. Peripheral vein. B. Central venous catheter. C. Arterial line. D. Any of the above. Answer: B. Central venous catheter. Which of the following is a potential complication of septic shock that may require surgical intervention? A. Acute respiratory distress syndrome, ARDS. B. Disseminated intravascular coagulation, DIC. C. Acute kidney injury. D. Necrotizing soft tissue infection. Answer: D. Necrotizing soft tissue infection. Which of the following is the preferred method for assessing fluid responsiveness in patients with septic shock? A. Central venous pressure, CVP. B. Passive leg raise, PLR, test. C. Pulse pressure variation, PPV. D. Echocardiography. Answer: C. Pulse pressure variation, PPV. Which of the following is the recommended target for mean arterial pressure, MAP, in patients with septic shock? A. 60 to 65 mm of mercury. B. 65 to 70 mm of mercury. C. 70 to 75 mm of mercury. D. 75 to 80 mm of mercury. Answer: C. 70 to 75 mm of mercury. Which of the following is a potential complication of septic shock that can lead to long-term cognitive impairment? A. Acute respiratory distress syndrome, ARDS. B. Disseminated intravascular coagulation, DIC. C. Sepsis-associated encephalopathy. D. Acute kidney injury. Answer: C. Sepsis-associated encephalopathy. Which of the following is the preferred method for monitoring tissue perfusion in patients with septic shock? A. Serum lactate levels. B. Mixed venous oxygen saturation, SVO2. C. Central venous oxygen saturation, SCVO2. D. All of the above. Answer: D. All of the above. Which of the following is the recommended treatment for refractory septic shock despite adequate fluid resuscitation and vasopressor support? A. Intravenous immunoglobulin. B. Plasmapheresis. C. Extracorporeal membrane oxygenation, ECMO. D. Therapeutic hypothermia. Answer: C. Extracorporeal membrane oxygenation, ECMO.